Good afternoon, all, and welcome to yet another event of the Continuing Medical Education organized by Faculty of Medicine, Bioscience, and Nursing, Massa University. This is our 87th CME, and today it's special that we have an external speaker for us. Uh, we have Professor Dr. Mohammed Sajhan Kabir. Something about Prof. Kabir. He graduated from the University of Chittagong, Bangladesh, with his MBBS degree in 2001 and furthered his Doctor of Medicine in Cardiology in 2013. And he also holds a certification in diabetology, and he has his FCPS in internal medicine, all from Bangladesh. And he has also done his diploma in medical education uh, in the University of Warwick, UK. Prof. Kabir actually started his academic career in 2004, the City Dental College Hospital, Dhaka, Bangladesh. And he had worked as resident medical officer of cardiology at various healthcare centers in Bangladesh before he actually took up his academic career in Malaysia at AIMS University in the year 2015. Following that, he had worked as associate professor of medicine at Quest International University, Ipoh, Malaysia. And currently, he's associate professor of medicine, Perdana University, Royal College of Surgeons in Ireland, Kuala Lumpur, Malaysia. Prof. Kabir has a lot of publications, and he's especially interested in diabetology and as well as medical education. So his research focuses on a lot of modern teaching methods and team-based learning methodologies and various other medical education related projects that he's holding currently. And today, Dr. Kabir is going to talk about management of type 2 diabetes mellitus during the holy month of Ramadan. And I think which is an apt time now to be discussing. I think our colleagues are going to start up their fasting from tomorrow, if I'm not mistaken. Yeah, I think it's the right time that we have him here. And Prof. Kabir, we are really happy to have you at CME Talk, the Faculty of Medicine, Massa University. And without delay, I would request you to start with your talk. Thank you, Prof.
Thank you, Dr. Deepa, for your nice introduction, and thank you for inviting me to Mahasa University. It's my pleasure to say on the very burning issue about the management of the type 2 diabetes matters during the holy month of Ramadan. Are you able to see my slides, Dr. Deepa?
Yes, Prof. Please
Okay.
go ahead.
Okay. Fasting Ramadan is one of the five pillars of Islam. Therefore, Muslim patients insist on fasting. But it's a very sensitive issue. Sometimes, in some perspective, that we are going to say, "Don't be fast." So, from the religious perspective view, we have to convince the patient. We have to gain the trust. We have to convince our patient managing their things. Because sometimes it may help. It may not helpful for them. It rather cause difficulty and develop some complications regarding diabetes matters. You see, these slides represents and the number of Muslims around the world, and the non-communicable disease like diabetes matters, hypertension is a burning issue in these countries. And the number of the global Muslim population is projected to 2.2 billion by the year of 2030. I came in Malaysia in 2013. At that time, one per six patient was diabetic, and since 2016, it's one per five patient is diabetic. So you see the graph that the incidence, and I believe after the COVID pandemic, due to lack of physical activity, this type 2 diabetes, the incidence and prevalence will be more. Anyway, you see, there are certain studies, the CREED studies and other studies showing that overall more than 85%, okay, more than 50% try to fast every day, and at least alternate day. I mean, more than 15% is uh, the patient with type 2 diabetes mellitus try to fast same things. So therefore, managing diabetic patient observe fasting is a challenging for the clinicians. Why? But I told that this is very sensitive issue. That's why you see there are so many verses and ayat in the Holy Quran regarding the Ramadan, in terms of purpose, in terms of the penalty, in terms of the rewarding from the Almighty. But you see, in the same Surah Baqarah, he also said that whoever of you sick or on a journey, let him fast the same number of the other day. That means it doesn't mean if you cannot continue fasting in the holy month of Ramadan, you can replace it in other days. And Allah does not burden a soul beyond that it can bear. So what happens in diabetes? What happens in the Ramadan, the body physiology? The eating habit changes in many ways in terms of meal time, pattern of meal, calorie intake, fluid balance, and there is changes in the sleep pattern. Okay, and the hormonal secretion, the circadian rhythm of certain hormones like cortisol, leptin, ghrelin, is also affected due to the sleep rhythm. So the Epider studies, they showed there is changes in the physical activity and the body weight, as well as ultimately their consequence effect on the glycemic control. And this is this graph is showing that the continuous glucose monitoring patient with diabetes before and during the Ramadan. You see, just before iftar there is a decrease of the level of the blood glucose, and just after the iftar the blood glucose level rise rapidly. So the risk associated with fasting in the month of Holy Ramadan is hypoglycemia, hyperglycemia, dehydration, and the acute complication, mostly diabetic ketoacidosis. And the study, you see, the EPIDA study showed that in type 2 diabetes mellitus, the incidence of the hyperglycemia increases fivefold, and the hypoglycemia increases about 7.5 fold. The very recent study, okay, this is Datu Zanaria Hussein in the Putrajaya Hospital. She also involved with the other global endocrinologist, and it's a very recent study. Okay, you see, the 1 in 3 either hypo or hyperglycemia develop, and the incidence of the hypoglycemia is more in the elderly patient, and the hyperglycemia in the below the age of 65 years. So the challenges as well as the counseling part from the perspective of the clinician should be first risk quantification. That means we must have to go for the search for the eligibility of the patient for observing the fasting, then monitoring of the blood glucose level, then the diet in considering the fluid and the other food, exercise, and the adjustment of the medication, which is very needed for some drugs. Okay, and the most important one is when to breakfast, when to breakfast. Okay, actually, this recommendation was in the last guideline, because considering the Ramadan and the type 2 diabetes and type 1 diabetes, there is a lot of study and lot of guideline is coming up. But I want to show what's the recent changes. So this low to moderate to high to very high risk, this for eligibility of the patient to observe fasting is from the old guideline. Okay, they have categorized moderate, low risk, and they recommended for moderate to low risk, yes, well controlled, they can go for fasting. Okay, whereas for the high risk patient, fasting is not advised, and the for very high risk fasting is not recommended. Okay, so based on, you see, the based on the blood glucose level, hemoglobin A1C, as well as the characteristic or symptoms or the comorbidities, they have categorized. But the recent guidelines, they have started with a risk calculation and the risk scoring. Okay, what are the elements? The elements include the 14 component, and there are sub component also. Diabetes type, duration of the diabetes, presence of hypoglycemia, level of glycemic control, type of treatment, self monitoring of blood glucose, acute complications, macrovascular complications, comorbidities, renal complications, pregnancy, and the frailty, physical labor, previous Ramadan experience, and the fasting hours. Okay, this based on this one, they have calculated this one. Okay, it's a recent TAR guideline. So, what is the recommendation? Recommendation is that if the score is 0 to 3, it is low risk. If the score is 35 to 6 is moderate risk. Is the score is more than 6, the high risk. Okay, for the high risk, previously it's not recommended, fasting was recommended, but this time I said that the issue is a bit sensitive from the corner of the religion. Okay, they say it should not fast. And for the moderate risk group, they said advise not to fast. Okay, they can try, but if any complication of anything develop, they should not continue fasting. And for the low risk group, they are able to fast, should be no problem. And the study said that the new IDF DAR risk calculator is comprehensive, easy to use tool. Okay, this is also from Datu Zanariusen, Putoja Hospital. We are thankful to her for such a nice study. And most of them found nice. We can using apps, one patient can easily calculate his or her risk and can decide. Of course, he or she needs to go for advice and the counseling from the doctors too. So the first important things is need, what is it, need education and counseling. Okay. So who are the target people? Target people are healthcare professionals, people with diabetes, and general public also. Okay. And you see here, one thing I want to mention, that there should be a unification of delivering message between the healthcare professional and religious leaders. Okay, why? Because some patients prefer to discuss regarding the fasting with their local imam rather than a physician. So understand. So there should not be any disparity. There should not be any difference of the delivering knowledge. So we must have to include the religious leaders in this counseling also. And what is the benefit? There is a study now called a read study. Okay, so read study showed that the patient without education experienced 4 times higher in the hypoglycemia. Okay, but who has been taught and counseled about the complication and management of the diabetes much before the Ramadan, their experience, the complication like hypoglycemia was lower on this group. Okay, one by one, we will now into how to manage. So number one is blood glucose monitoring in Ramadan. Okay, okay. There was the ayat that if there is any bloodshed from the body, so your fasting will be broken automatically. So that's why people were fair, especially from the illiterate people, they didn't want to go for any blood checkup. Okay, so I'm showing this one. There was a appeal to the Egyptian and the religious scholar, okay, international national level. The, will there any problem if patient with diabetes might go for blood checking for diabetes? No, they said no. Both national and international scholars of the Islam permit blood glucose monitoring while fasting. So when the recommended time? There are 7 timings. Okay, the pre-dawn meal. So then morning just after the sahur, 1 hour after the sahur, then midday, then mid afternoon, then before iftar, just after iftar, and anytime who is experiencing any time of symptoms of hypo or hyperglycemia. So here you see that there are 7, that means so many times, right? So some are, we are not encouraging to go for it unless and otherwise very uncontrolled diabetes mellitus. Okay, but at least at least that means if anyone to go for that if anyone doesn't want to go for the 7 times, okay, if only one checkup, we usually prefer 1 hour before iftar. We are not encouraging them. Okay, at least two checkups should be there. 1 hour if before the iftar and 2 hours, 2 hours after the sahur. Okay, so this will help to detect the subclinical hypo and hyperglycemia. Okay, so when we'll call hypoglycemia, 1 hour before iftar, if the blood glucose level is less than 3.3 millimole or 160 milligram per dl, or when after 2 hours after the sahur, if the blood glucose level is 5 millimole or 90 milligram per dl. So this is done. So in for that means pre-prandial before iftar less than 3.3 millimole, and the postprandial just after the sahur less than 5 millimole. And hyperglycemia is 2 hours after iftar if it is more than 10 millimole. Okay, both for sahur and the iftar. Our target should be 1 hour before iftar, 5 to 7. This is our target. Okay, when to break the fast, this is the most important things. When anyone, now if number one, first one is anybody is having symptoms of hypoglycemia or hyperglycemia. Okay, so we all know about it. We'll educate the patients. Yeah, what are the symptoms of hypoglycemia, what are the symptoms of hyperglycemia. Okay, if patient have confusion, palpitation, sweating, okay, altered maltose, headache, okay, things that will be, patient may be developing hypoglycemia. Okay, if there is a sign of thirst or dehydration, okay, excessive osmotic diuresis and frequent urination is there, confusion, abdominal pain is there, so chance of hyperglycemia. This all these symptoms will educate the patient. Okay, then definitely the suggestion is go for capillary blood test, capillary plasma test. And if it is before the iftar less than 3.3 hypoglycemia, I already mentioned this one. Well, now regarding the management of type 2 diabetes, as before Ramadan, it is 3D: diet, discipline, and the drugs and the exercise. So the adjustment of the diet and the exercise in the during the time of Ramadan a bit difference. Okay, yeah, fasting is not about to just fasting that is get rid of diet. Okay, it's about to diet burning calories. It's not like that. It's also burning the ego, pride, and sins. Okay, and you see, there is a plan regarding that. It's a big chapter, like Ramadan nutrition plan, we call RNP. It's a big chapter, so I am just highlighting the major thing. So in a nutshell, they say that a weight maintenance and weight reduction diet based on your height and weight chart or BMI. If you are in the range of overweight or obese, you should go for the weight reduction diet. And if your BMI is not overweight, is within the range, you can go for weight maintenance diet. So this is the things. And here you see the major bulk of the meal should be percentage of the calorie. Major bulk should be iftar. Okay, so iftar is the main meal. Iftar is the main meal, and this is the main message regarding the diet, regarding the food intake of Ramadan. What is that? The main important is that the divide and educate amount of calories between the sahur iftar. Educate, but main bulk will be in the iftar. Okay, and you see the carbohydrate should be 40 to 50%, protein should be 20 to 30%, and that should be exchange of carbohydrate is better. Okay, and avoid sugar heavy dessert. Avoid sugar heavy dessert. Okay, that means monosaccharides, high sugar diet should be avoided. Okay, but we should encourage to take the carbohydrate having low GI, that means low glycemic index. Okay, and fiber rich, plenty of fluid, plenty of fluid should be there. Okay, plenty of isotonic drink, plenty of fluid, but not sweetened beverage. Okay, and the important one is for a diabetic patient that some persons, to reduce their weight, they skip the sahur. No, we this is not encouraging, this is not accepted. Okay, so what is that you must go for sahur, and the thing is the sahur should be as late as possible, just before the prayer, just before the prayer, that on the final time of the sahur, just the last time of the sahur, you should take as late as possible. That's the important. Okay, And I must going to say something with the dates, because some people dates are very sweet. No, you see, the 100 grams dates is 50 to 100% of the recommended dietary fiber intake. Okay, and it's a low glycemic index. Okay, the high fructose content, okay, and low glycemic, more powerful sweetener than glucose. That's it. And the thing is that it slowly absorbed, the benefits is slowly absorbed and maintain a very baseline and nice sustain and baseline blood sugar level. So consumption of the dates is no harm, it's good, but you should take it. That means you must not take a lot. Okay, and physical activity should be reduced during daytime, because there is Tarawih is there. It should be increasing the prayer during Tarawih should be taken as an account as an exercise, additional exercise. So that we don't want anyone to go for any vigorous or strenuous exercise. Okay. Now, one of the important thing is, sorry, the adjustment of diabetic drugs. Okay, we have got a lot of oral anti-diabetic drugs, very newer agent and injectable drugs. Okay, so you see, there is a study. Okay, they showed that the overall antibiotic drugs, okay, had to change overall. Okay, anti-diabetic medication, including OAD and insulin, is nearly 50%. That means dose modification is needed. It means pre-Ramadan counseling is very important. Pre-Ramadan counseling with a endocrinologist, internist, or a general physician is mandatory for any patient with diabetes who want to fast. Now, what happened? Patient, whose glycemic control is very good on diet and exercise, that means very initial stage of type 2 diabetes, they no need to need any change. Okay, but they need to only ensure the adequate, go for adequate fluid intake. Consider the metformin. You see, uh, the first one regarding the drug modification, our main meal should be iftar. Iftar should be taken as lunch or morning breakfast, the main meal. Okay, so the main medication, the bulk of the medication, the doses fraction should be more in the medicine taken before or after the iftar. Okay, so if 500 patient getting the metformin once daily, only 500 milligram, no need to change. If patient takes the metformin in the morning, just shift this to the iftar. Okay, that is the. Now patient getting more metformin twice daily, also no need to change the doses. Okay, patient getting morphine, suppose the 2000 gram in twice dose, I'm coming here. Okay, three times daily, then what we'll do, the afternoon, midday and the morning dose should be taken in the iftar, during iftar, and the night dose will be taken during the sahur. About the sulfonarily, okay, we encourage to take the second or third generation sulfonylurea. Okay, this modification is very needed because chance of hypoglycemia is more. That's why we encourage to avoid the first generation sulfonylurea, because the hypoglycemia event is more. More is very good if one can go for sustained release sulfonate, that is glycoside dimer. Okay, it should not, and it should be taken before the iftar. Okay, it should be taken before the iftar. Okay, and if it is splitted dose, look how we'll do. We'll take the morning dose at the same dose in the iftar. The night dose will just make it 50%, and half of the night dose will be taken in the sahur. Midday, if anybody taking midday dose, we'll skip the midday dose. I'm coming again. If anyone taking go for three times daily, the no need to go for midday dose, skip the midday dose. The morning dose should be shifted to the iftar, and the night dose should be reduced to 50% and taken in the sahur. Same thing what I told in the regarding the sulfonylurea. Okay. Now acarbase, no dose modification is considered. Okay, acarbase. And regarding the thiazolidinedione or pioglitazone rosiglitazone, I have given cross mark because nowadays we are not encouraging, we are not giving due to so many side effects. Moreover, pioglitazone it causes fluid and water retention, understand. So and rosiglitazone and is withdrawn from the market for due to a lot of side effect adverse effects. So we should not promote this drug to any diabetic patient nowadays. Well, DD for very sitagliptin, vildagliptin nowadays very popular drugs. Okay, and no dose modification is not needed because no RCT or hypoglycemia on RCT. Okay, and it should be taken in the iftar. Okay, and you see the regarding the creatine my that liraglutide exentanide exenatide and liraglutide. Okay, no further treatment modification is required. Okay, and another popular drug now is this that is SGLT2 inhibitor. Okay, in the previous guideline there was no study, and they said since there is a chance of dehydration and ketosis, um, they didn't encourage. But now said okay, it's a there is no chance of low risk of hypoglycemia. There is no dose reduction adjustment are required during Ramadan, but to avoid dehydration must take drink plenty of, and it should be given in the iftar, must take plenty of water to avoid the dehydration. Okay. Now about the insulin, the same as sulfonylurea. In the insulin, if it is splitted doses given, the morning dose should be shifted to the evening iftar, and the midday dose should be omit, and the night dose should be reduced. If diabetes is very uncontrolled, no need to reduce. If diabetes is very well controlled, we can reduce 50%. If diabetes control is not that much control but not with the expected level, we can reduce up to, that means based on the conditions the doctor will decide how much he or she will reduce for his patient or her patient. Okay, so the general norm is, the if anybody is getting three doses, short acting three doses, okay, the morning dose should be shifted to the iftar, and the evening dose should be reduced based on the control of diabetes mellitus. And based on the control of diabetes mellitus, the morning, the midday, some fraction of the midday dose can be added with the, so this added with the iftar, the dose before the iftar. So what I'm saying that this decision will be taken by the um, doctor. So I'm just giving you the message that the dose modification must be needed for sulfonylurea and the insulin. Okay. So this is the new guideline. What I given in these slides, new guideline, the how to changes the if for short acting, long acting insulin, pre-mixed insulin, and how to reduce in unit in terms of unit. Okay, and insulin pump. This is the new drugs. Type 1 diabetic patient now they are using insulin pump and attached with a belt. So these are the things given. uh, Regarding the fasting the pregnancy, you see the pregnancy, the blood sugar should be very tightly controlled, very tightly, because there is a chance of a lot of complications to the offspring. That's why it is there is no bar regarding the pregnancy. We also, like other patient, we have to calculate the risk and score, and then we can decide and we can suggest whether the patient will go for fasting, or fasting is recommended, or fasting should not be recommended, this one. But I'm the message is, any degree of complication from the any degree, that if patient feel it may hamper the kids, coming kids, so she should not be go for. I'm almost at the end of my presentation. You see, this is the very new recommendation, that what is the role of a physician for the patient who want to be fast regarding type 2 diabetes management. Okay, there should be pre-Ramadan some counseling, and there should be during the Ramadan. Okay, And already I described, but this is the summary of all these things, that we must have to educate the patient. The control of diabetes matters does not only mean the only sugar control. Okay, the control of diabetes matters mean, along with the control of the sugar, your body fat will be controlled. There's a range, and your blood pressure should be in optimal range, as well as your the BMI. Okay, obesity, your BMI, body weight, as well as the new thing is empowerment and education. Unless and otherwise we can educate the patient, there will be, the goal will not be obtained. So that's why there is a new, the diabetes cannot be controlled only by the physician. So in between the physician and the patient, now there is another person, the educator, diabetic educator. It doesn't mean he or she should be from the nursing or doctor physician pole, or maybe from, only the name is diabetic educator. It doesn't mean he should be doctor. So they educate the patient, and we must have to educate the patient. So already I told that we have to quantify the risk, to see the eligibility, and self monitor the blood glucose, and warn the patient, educate the patient about the symptoms, when to break the fast, and when and how and what to exercise, and meal planning, and adjustment of the medications. Then you see, to see, we have to also go for detailed physical examination and history taking, to find out the comorbidities, to find out that means the risk calculator and the risk stratification. Okay, then during the Ramadan, you see, we need to do, it's not like the as usual time, that when we'll call, when we'll say hypoglycemia, when we'll say hyperglycemia, we have to educate the patient. Okay, then of course after the Ramadan, we cannot continue the patient with the same dose, same medication. Okay, so there should be another counseling, another patient. Well, this is the already told that to avoid the hypoglycemia, we should take the sahur as close as last time, keep some calorie during Ramadan as before, changes the schedule of the composition of the meals. Okay, the take home message is the uncomplicated type 2 diabetes can fast in Ramadan. Okay, the pre Ramadan education is very important to minimize the risk, and dose adjustment of the anti diabetic drugs is mandatory during Ramadan. And Islam allows blood glucose monitoring while fasting. Okay, so may Almighty Allah forgive us. Ramadan is about the losing sins, not weight. Thank you very much.
Thank you, Prof. Kabir, for that informative talk that you have just delivered. And the audience, can I please request you to post your comments, post your questions in the comment box so that we can address that. Um, Prof. Kabir, actually, we have few comments. You can just see there. I think it's Prof. Razif Ali there. He says the fasting may help to discipline eating habits, therefore control the adverse effects of diabetes and weight problem. So he has just left a comment there.
Uh, Yes, it is. It is. But a problem is, there is a big iftar bazaar in in Malaysia. Not only the people who fast, the all people go there and shop. Actually, for the diabetic patient, this time, 5 p.m. to 6 p.m. This is the time to resist himself. Okay. Problem is, we break our fast with a lot of food. So the ultimate effect of the fasting, not is ultimately it's not coming out. You see, the recently one scientist from Japan, he got the Nobel Prize based on the theory and the intermittent fasting. Okay, so all actually you see the Ramadan, we can call it that fasting is there, right? But we break our fast with a lot of food, and we don't follow that the discipline regarding our diets. So That's why instead of losing weight, we gain weight most of the time.
So yeah, yes, Prof. Because the risk of post-prandial hyperglycemia after the
Yeah,
pre-dawn and sunset meals, right? Yeah.
yeah, yeah.
And as you said that patients overindulge in eating, and as you said in Malaysia, you have variety of food displayed there, and even the people who don't fast, we go there to get food. Yeah. So your suggestion is to distribute calories over two or three smaller meals, right, during the
Right, right, right.
non-fasting
Yeah.
interval.
And
Thank you.
in the iftar also, that we can take some snacks and go for then we go for the evening prayer. After
Mm,
the evening prayer, before the Tarawih, that means the night
mm,
prayer,
mm,
we can go for the main meal. So
mm,
after the main meal, you see, if we go for the night prayer, it is an additional exercise, so calorie will burn. So
mm,
we can plan, and we can distribute our food and the calorie intake
mm.
like that, so it will be helpful.
Yeah, yeah, yeah. Prof, you had mentioned about the physical activities during the Ramadan month, right? Like, what is your suggestion on how should the physical activity be modified in its say in its intensity and timing? Like, for example, how many hours after the sunset meal it is recommended to do a mild physical activity, if not very intense, that they usually do.
Okay, the first of all, regarding the physical activity, we encourage the aerobic exercise. I am not telling only for Ramadan. For any diabetic
Mm,
or hypertensive patient, we don't encourage the anaerobic exercise. Okay, we encourage the aerobic exercise. And as a whole, okay, as a whole, the rule is you have to go for at least 40-minute exercise. 40-minute exercise and at least for 5 days. There should not be gap more than 2 days. Okay, two, you can give a gap 2 days, but more than 2 days you should not give. So 5 days in a week, you should go for 40 minutes. Any it's your convenient time. First one, it is your convenient. You can go for that exercise either morning, AM, or evening, PM. But we, as cardiologists, we encouraged to go for exercise in the PM, because why? When you go for exercise, due to the circadian level of the circulation, the secretion of the cortisol, which is cardioprotective, the level of the cortisol is less in the evening and at midnight, okay, the morning. But if you go for exercise, during the exercise the cortisol level is increased, so it remains in your blood. And most of the heart attack you see at night, most of the patient, that they experience heart attack, the agent called the myocardial infarction at night, so it is cardioprotective, the study stage. Now, regarding the Ramadan, we don't encourage any patient to go for that vigorous exercise. Okay,
mm,
and before one, this we should have to know. We have to know what is exercise. Some people you see that went out, go to the park. On the right hand, there is a stick. On the left hand, there is a dog, and they just walk with a very slow pace. No, exercise is just very simplified with this. When you just count your baseline heart rate, suppose it is 60 or 70, and when you are running or jogging, or you are walking very fast, then in one moment you just count your heart rate again. When it is double of your baseline, that means if it is 60, it should be 120. If it is 70, it should be 140. Your body is in the hormone exercise. It's like boiling water. At that moment, if you go for 40 minutes, 50 minutes walk, this is exercise. First one, we have to know what is exercise. Okay, we don't promote or encourage our patient, or we don't advise our patient to go for such kind of exercise during the time of Ramadan. Who want to fast? If anybody wants, you see, after the Ramadan, after the breaking fast, that means after the iftar, the Tarawih is there. Because I strongly believe everybody is go for Tarawih. It's a 40 raka, 20 raka salah. Okay, so it's a long salah, so it's a additional aerobic physical exercise. So we don't want, if anybody want, whose body is obese and blood glucose is not well controlled, just before iftar, we say that you can have some light exercise. You can walk, but not that pace. Okay, you just walk. You can walk for 30 minutes, 20 minutes just before iftar. Okay, you see, the study said that the most of the persons developed hypoglycemia or hypoglycemia in the first week of the Ramadan. So who wants to be continue exercise, I believe that they will understand just before iftar, 20 minutes iftar goes, they will understand that what kind of whether they are developing any complication or not. So if anybody develops symptoms of hypoglycemia, we say not to go for. If you want to continue fast, not to go for exercise. Okay,
Exercise.
diet
Thank you,
will
Prof.
help a lot. The good diet will help a lot. It will also cover up the exercise part. The of
Thank you for that reply, Prof. And we have Dr. Sani Sharehuf Latan. I don't know what she means, but she asks what I will do during the fasting.
what I will do. Yes, I saw Faria, but okay. What you will do during the fasting? First one is the fasting is to burn our sin. Fasting is to burn our egos. Okay, so that's the first thing we have to do, and keep my family, keep us in your prayer.
Prof, many other comments. This is from Ms. Sumaya Zafrin Chaudhary. Very informative. Thank you so much. And Mr. Uday Singh Dadwal. Good afternoon. Very interesting and informative talk. And again, Dr. Lubna, thank you for sharing the information. Dr. Marjan, very comprehensive presentation. That's just a comment. And Mr. Tanveer Hossein Parash, excellent presentation, very informative and timely. Yeah, timely. And Prof. Abdul Razak, Dato Razak has just commented. Thank you for the lovely talk, Prof. So that's the comment. So,
Thank
audience,
you.
if you have any further questions, please do post it in the comment box. Request you to post your questions in the comment box. Prof, in diabetic patients, right? Like if they have a very controlled lifestyle and they have a controlled diabetes earlier, and or if they are already used to fasting once or twice in a week throughout the year, will that help during the fasting month?
Well, the considering the type 2 diabetes,
Hmm.
that yes, I mean that even you develop diabetes if you have healthy lifestyle. Truly speaking, so we based on some risk factors, we can assume that you are very prone to develop type 2 diabetes mellitus. Positive family history, and most important is obesity. Okay, the obesity. So the only one thing you see that if you can control your body weight, you can maintain your body weight as per height weight chart. Okay, the best thing is as per height weight chart. There is a range. You will get in every diabetic book, even in the internet, in every apps of BMI. There is a height weight chart. You will just put your height, you will just put your weight, and they will, once you give your height, they will give your weight should be from this, the minimum this, maximum this one. If you can maintain that weight, the development of diabetes mellitus, even the positive family history, the that it will be late, probably late. So for type 2 diabetes mellitus, the proactive, what you are saying, that prevention or proactive is that healthy lifestyle in terms of diet, and the curve. Actually, even fat is better than the curve. The curve is really is, but we cannot avoid the carbohydrate, the things.
Thank you. And we have one message from our dean, Prof. Rusli. Thank you for a great opening to Ramadan. Al Mubarak. Yeah. So that's a
Ramadan
message
Mubarak.
from. Okay, so with that, I think no more questions, Prof. I think we come to an end of this session, and we are very happy to have you here today. Actually, hope to see you in another CME event, and I wish that you give us another presentation in future. And
Thank you.
yeah,
Thank you.
thank you so much for your time, Prof. Thanks for
Thank you. Thank you very much.
presenting
It's my
today.
pleasure to be here. It's my pleasure to be here, and the arrangement, everything was very nice. Thank you very much.
Thank you, Prof.
So,
So thank you, all of you, and we come to an end of our 87 CME event. I request all of you to follow the link that I've given in the comment box to mark your attendance for the CPD points. So this event is entitled to procure one CPD point, and please mark your attendance by Monday, 12 p.m. For you to get your CPD points. And I think for the MASA staff, I already sent the attendance form through your emails. So you can also go there and fill up your Google Forms there. So thank you so much to all of you who were just connected live with us, and hope to see you all in the next CME event, which is again scheduled in this month, the third week of this month. So until then, take care, all of you. Thank you so much.